My name is Jed Nielson, and I have been a physical therapist for 19 years. And I have been always looking for a product, that would help my clients. And to this date, I have never found one that would effectively help them that was out on the market as far as inflammation. And so when Byron Belka, the founder and president of the company, introduced me to the company and to the product, initially I tried it on myself, and then I eventually started breaking it in with the patients that had pain and inflammation. And so when initially I started using the product orally with all the patients, and I had patients that with severe osteoarthritis, with acute conditions such as knee replacements, as far as other pains, fibromyalgia, chronic fatigue syndrome, things like that. With this product, initially it would take anywhere from 2 to 8 days, for them to see some results as far as like pain relief. It wasn't up until 3 or 4 weeks ago when I was introduced by Dr. Weeks the fact that you can actually use this product topically. And so I started using the product topically 3 weeks ago with patients, and I have seen a significant improvement with the patient's alleviation of pain since I've started using the product topically. It's important to let them know that we all take supplements and we all take vitamins, and most of those are synthetic. And our body has a really difficult time absorbing because it's not bioavailable to our bodies. And so this product is giving you all the nutrition that your body needs, and it's seed based, so it's natural, and our body is able to absorb that and utilize that. And so it's a broad spectrum benefit for our bodies.
Yeah, so Jed Nielson. Okay, perfect. Thanks, Jane. So Jed's been using the product for a while. He's going to tell us all about it. And so thank you, Jed, for joining us and sharing all your experience and your expertise. Could you just kind of tell us, you're a physical therapist in private practice in Utah, and so clearly you're working with people who need physical therapy, right?
Yes.
So there are a lot of injuries and things that you're working with. Could you please share a couple stories of how some of the things that you've seen, how does Soul help you in your practice, help your patients?
Okay, perfect. Well, thank you, Tina, for having me on. But yes, so when someone needs the services of a physical therapist, they come to us for one reason, and that's usually pain. And pain is always 100% of the time associated with inflammation. And up until I found out about this product, Soul, there was never a product that I ever in 20 years of practice ever recommended to a patient to take because there was nothing out there that you could actually look the patients in the eyes and tell them exactly what it would do for them. And so even when Byron introduced me to this product, I was still skeptical because, if you don't know my history, my brother happens to be the president of a manufacturing company who produces like most of the major juices out there for all of these MLM companies. And so I've had the benefit of using all of them. I've never, ever felt anything on any of them. And so I've never recommended one single product before. And so with this one, right after I started, I had a patient who had a total knee replacement a year ago. And this was a younger gentleman. He's still a professor at the University of Utah. And it was a year that since he had the surgery, and he called me. He said, this knee is still bothering me. He goes, I still have so much pain. He said, I went back to the surgeon, and he just shrugged his shoulders and said, sometimes these work, sometimes they don't. And he said, so I'd like to come in and have a second opinion. And I just happened to have a case of Soul with me at the time, and I said, I've got this product that I'd love you to try. And so I had him text me every single day, and within 2 weeks, this gentleman went from not being able to go up and down the stairs without severe pain to no pain at all. And then he sent me a text 2 weeks later, and he said, I just went to Disney World, walked around Disney World for a week, no pain. And then a month later, he said, I just took a 2-week vacation to Greece, walked around Greece and toured the area, no pain. And so to
wow,
me, that was the very first.
Well, let me just ask you a question real quick. How much was he taking?
He was taking 2 packs a day.
Wow. Okay,
yep.
So 2 weeks. And so when you tell people to take this Sol, what do you tell them about how long to take it and how much to take?
Okay, well, first of all, I always tell people, and you have to bear in mind this was the very first patient that I tried it on. And so right now what I tell patients is to front load it. So I would say I recommend, starting out with 3 packs and then wait till the pain diminishes or is completely absent and then go down to either 1 or 2 packs a day. And that, quite frankly, that depends on how large their body stature is as well as how severe the pain was to begin with.
Okay, so like if a person is a bigger person, they should probably take, how much would they take?
You know what? If you're a large person, I would take probably 2 to 3 packs.
A day, right off
the
beginning. Okay.
Yeah. Mm-hmm.
Well, do you have another story about, let's say, now this was a professor at the University of Utah that you're talking about with their knee. How about an athlete? Clearly you work with athletes, so.
Right. Well, the biggest thing now, and let me just tell everyone up front, this is what I've come to realize. If the pain is chronic in nature, it's going to do well to take this orally. If it's a very acute in nature, like an ankle sprain or a muscle strain of some sort or an injury of that type, even shin splints, rubbing this on topically will, it's amazing the effects that we're having. And so just like that, I had a patient the other day who his shin splints were so bad, his wife told me, she'd wake up in the middle of the night, he'd just be sitting up on the side of the bed grimacing, because of these shin splints. Obviously, that's an acute condition. And so we actually rubbed this on, that area of pain in the shin splints, and within about 8 minutes, he's completely pain-free. And so I told him to text me, and this just happened 2 weeks ago. So I told him to text me. I said, I want to find out how long this pain lasts. Well, it lasted for almost 2 days, just that one application. This is not taking it orally. This is just topically. So I went back. He came back in 2 days later. We did it again. And anyway, same thing, took the pain completely away. He drove down the next day to the headquarters in American Fork and bought a case. And now, and what's interesting about that is just from seeing that, his wife actually works up at the VA hospital here in Salt Lake. She has a friend whose daughter plays softball for Boise State, and this daughter happened to get hit in the face with the softball, and just completely, her face was just completely distorted because of the swelling. Anyway, this patient's wife got that lady to start giving her daughter Sol to take away the swelling and the pain. And in 1 day, that the softball player noticed a complete difference.
So you're saying that. Now, could you explain how this works topically? Because, people hear this, but then they don't do it. And so how is it that it works so well topically, and why should people be putting it on topically?
Well, if you've ever rubbed this on, it absorbs, the oils absorb really, really efficiently. And, all you have left is the residue. It dries and absorbs really quick. And so the absorption rate is great. And what that does is, put it this way, in my practice every day, I use this product topically on almost every patient with acute pain. It's that beneficial. It's one thing to take it orally, but it's a completely different thing if it's an acute pain. And oftentimes when we're seeing a patient, it's not a chronic condition, it's more of an acute pain, like, they've had suffered an ankle sprain or a shoulder strain. Well, and I have the benefit of using machines, but you don't even need a machine like an ultrasound or an infrared. You don't need that. All you have to do is rub it in. And, and it's when you ask me how it works, well, Tina, I can't really tell you how electricity works. All I can say is when I flip the switch, the light bulb goes on. With this, when you rub it on, the pain goes away. I mean, it's such a strong natural anti-inflammatory.
That's amazing. So, but I heard you say that you actually rub it for 20 minutes. So as it starts to dry, do you apply more?
Oh, you don't need to rub it for 20. I mean, usually if you're rubbing it for 8 minutes, it's you're good to go.
Okay, so as it starts to dry, you just put more on and just
right.
rub
I just
it
put
in
a little
there.
more on. Yep. And just
rub
keep
it in
rubbing
like
that in.
an ointment or something.
Okay. Exactly.
Well,
in fact, I no longer use pain creams, and the pain creams that I personally buy are very expensive pain creams. That we're talking upwards of $50-$60 for a small bottle.
And he's saying he's
okay. So hold on one second. So we're hearing other people talking on the phone, and that's probably because you haven't muted yourself. So could you please mute your phones by pressing *6? That would be helpful. Thank you. Okay, Jed. Let's. So what were you saying about pain? What?
Oh, I said I no longer use pain cream. So before,
cream.
I would always use pain cream, and now since Soul, that's the only thing that I use. I no longer use pain cream. This is my new pain cream.
Wow. Okay, so could you tell us another cool story that you have based on your experience?
I've got so many stories, it's ridiculous, but I'll share some of the broad spectrum stories that are. So I had a patient that came in. She had chronic neuropathy for upwards of 13 years. And
now what's neuropathy?
Neuropathy is it's basically you get it when you're you can't, mostly oftentimes it's associated with diabetes. But what happens is it's a nerve pain, and so it's in your feet and in your hands, and usually most common it's in the feet, and it'll go all the way from the toes to the knees. But and this pain, it's right now it's almost untreatable, because what they do is they give you Neurontin or gabapentin, which is the same. It's generic for Neurontin. But what happens is that's to treat nerve pain. And usually the effects of that will wear off within about 6 to 8 months, so you no longer have the effect of the alleviation of the nerve pain. Well, this patient, when we go in, we have them say what their pain is on a scale of 0 to 10. This patient, I've seen her for 2 years, and it's always been 7 out of 10, 7 out of 10, 7 out of 10. And so finally I just said, you know what, if this works for everything else, why wouldn't it work for neuropathy? And so I rubbed it on her hands, and no lie, Tina, after one application on her hands, she was pain-free for 6 months.
For 6 months?
For 6 months after one application.
Oh, wow.
Yeah,
That's
no
amazing.
machines, nothing, just rubbing it in. And that is something. And so after that, I started using it on the feet with patients with diabetes. And then I'd say, okay, and then I'd, take a baseline, and the second patient that I used it on her feet, the exact words were, after I applied it, she says, it feels like my feet are running. And see, and usually with neuropathy, you have no sensation. All you have is the pain. So you really can't, you have the numbness, tingling, and pain. You can't feel them. And she said for the first time, and this lady was 7 years, she said it felt like her feet were actually running, just with that soaking in.
Wow. That is impressive. We have such a powerful product, and so many people need this. Well, can you? I know you have lots of stories. Can you think of maybe something else?
Right. I had a patient. This was one of my first patients that I used it on as well. This patient was she was status post 100 days of a stroke, and oftentimes with stroke, if it's severe enough, they have what we call a subluxed shoulder, and that's where the muscles can no longer hold the joint together, so it kind of separates. And it's one of the most painful conditions we know of with those strokes, is because they're if you can imagine your shoulder separating about a half inch. That's the kind of pressure. Anyway, she was on Percocet, which is a narcotic. And when she came home from rehab, I started seeing her, and she went back to the doctor's office because she'd ran out of Percocet. Well, she'd been on Percocet for 100 days. And the doctor said, I'm not going to give you any more Percocet. That's a narcotic. We have to go off it. Well, she was just furious. So I told her about this product. I said, I don't know if it's going to help or not, but you know what? I'd try it. Anyway, she started out taking 3 packs a day, completely took away the pain, And she felt so good, she started taking 5 packs a day because she goes, if 3 packs is good, 5 packs is going to be better. But she didn't need that much. But so she just completely eliminated her need for a narcotic.
Wow.
And it happened in a 2-day process, in 2 days.
In 2 days?
Yeah.
That's great. Wow. So we Jed, usually we say go do 1 pack the first day, 2 packs the second day, and then if you have a lot of pain, 3 packs. But you just start people who have intense pain out on like 3 packs a day.
Right. Yeah, I like to front load because I like to get it in their system. And here's the way I describe it to patients. I say if you have chalk on a chalkboard, let's consider all of that chalk inflammation. And let's consider this pack of the soul like the eraser. Every time you take a pack, you take that eraser, you're wiping off more of that inflammation. And so I like to front load to get that pain down, and then after that they can go on more of a maintenance program.
Right. Okay.
Where they use the 1 to 2 packs a day, yeah.
Okay. Well, how about one more story, and then I'd like to have you talk to us a little bit about athletes and their training. But first, let's hear just one more cool story. You have so many good ones up your sleeve.
So I had a patient who came to me. She was unable. First of all, she was I would consider morbidly obese. She was quite large, but she was in a condition where she had renal failure. She had congestive heart failure, so she was not a candidate for a hip replacement. And her hip pain was so bad she could not bear weight on it. She could not stand on it. And so my whole objective here was to try to get her to be able to bear weight and stand on that hip, on her right hip. And so I talked to her husband about it. I said, you know what? This is a shot in the dark, but I go, there's really nothing I can do. I mean, she's bone on bone. She's her weight is playing a huge factor in this. And I said, our only chance is maybe to put something in her that's natural, that's not going to hurt her kidneys, because she's in renal failure. And so we ordered her a case, and she started this on a Friday afternoon. And at this point, I'd seen her for 5 visits, still no luck getting her to stand and bear weight on that leg after 5 treatments. And so when I went back, we saw her again Monday, and Monday she was smiling when she came in, and she said, look it, and she stood up and she walked about 8 feet. Now 8 feet doesn't sound like a long ways, but you have to realize it was 5 treatments. It was over 2 weeks when I was working on her, and I couldn't even get her to bear weight on that right leg. And now after 2 or 3 days of soul in her body, she was up walking 8 feet.
Wow.
So that's the kind of, I mean, it's allowing us to do things that are impossible to do.
Thank you, Jed. All right, now I know that you work with athletes, and my understanding is that you've noticed some ability that they have to, train harder, whatever. Well, I'd like to hear what you think is how Soul helps athletes train harder and perform at a higher level. Basically, that's what we want to know.
The first thing I've noticed is the recovery time. If you're an athlete and you're pushing your body day in, day out, well, you're not going to be at your peak performance unless your recovery time is expedited. And so with this, obviously, in my opinion, this decreases the amount of lactic acid. Lactic acid is part of the inflammation process. It's there to, and so if we can minimize or decrease the amount of lactic acid that's built up in the muscle groups that we're working, then obviously our recovery time is going to be, significantly shorter. And that's the first thing we've noticed is athletes just don't have the soreness. They don't have the stiffness. They don't have the, they can go back out day after day after day and get the results that they're looking for without that, the aches and the pains of the lactic acid. And the other thing that we've, we've noticed is where a lot of people, whether this is psychological or not, but they just claim that, they don't have the fatigue that they used to have when they would, when you hit that proverbial wall, like whether you're cycling or whether you're running, they just, that wall doesn't seem to come. And so they can just, keep going and push through that without hitting that wall. And so and that's the things that we're noticing. But once they're injured, that's when it plays, even a bigger role, is because we can get them back and then competition a lot faster than if they were just, we're doing the ultrasound. I call it fake and bake, because a lot of those modalities that we use, it feels good, but does it really benefit you? But with this product, they've actually, not only does it benefit you, I mean, we see a huge difference. But yeah, and so for all the athletes, that are listening, this product, and I would hallucinate that, because everything I've read about black cumin, it magnifies everything. And so a lot of athletes, they're taking a pre-workout drink, they're taking a workout drink, they're taking a post-workout drink. It'd be, in my opinion, I think that when you combine all of those elements with the black cumin, I think it's just actually it magnifies it as well, just like it does everything else that it combines with.
Right. Now, we were sort of talking a little bit about why you think when athletes hit that wall, they don't hit the wall. Now, why do you think that is?
Well, in my opinion, I believe that it's because of the VO2 max. I think it just allows the oxygenation that's occurring, in the lungs. I think that we just don't fatigue like we normally would, and why that happens, once again, I'm not sure, but I would love to. I'm looking. I've got a place now that we could actually, connect them up to some monitors, but it has to be someone who has never tried the product and
right,
who is
right.
active. But if we can get some results back on that, it'd be huge for us, because
right.
Every athlete is looking for an edge, and
right.
and if we can give them a natural edge.
Right. So what I'm hearing you say is that you're planning to do some official tests of VO2 max, but up till now, from what you're seeing and watching athletes train and getting the results of their training and their performance, you believe that there's a huge increase in the VO2 max that athletes have, which is actually the ability for the body to take up and use oxygen more effectively. And so that's what you're seeing at this time, and that's why you are motivated to actually do an official test research.
Right.
Okay. All right. Well, Jed, I just want to thank you. Our time is almost up here, and your experience is fantastic.